Justine, are you ready?
Yeah, ready.
All right, let's get after it. So, what is up, everyone? Welcome back to another live. Today, we are joined with a very special guest. This is Dr. Justine Luchini, the co-owner. Should I say co-owner of Thirdzy?
Yep,
Okay.
yep.
Co-owner of Thirdzy. It is a sleep supplement brand. We have my other channel, the podcast. We've been working with you guys for like a few months. Yeah.
Yep.
So 3 or 4 months. We really dig the product a lot. I'm not a fan of melatonin. We'll get into the whole formulation of this supplement, but we found you because we became friends with Nicole, the Hair Strong lady, and because
Mhm.
we followed Jason Grubb because he's the coolest old Masters athlete ever, and
Yeah.
yeah, we got into contact. So Dr. Justine, my
Yes.
my audience is mainly people that deal with a chronic illness called POTS syndrome, postural orthostatic tachycardia syndrome. I'm sure you know what that is. We'll get into what you know about it in a little bit. But so yeah, I thought that'd be beneficial to have you on to talk about sleep, supplementation for sleep, why it's so important, because a lot of what the population deals with is stress, and insomnia is a big thing for people with POTS syndrome. And maybe you can give some tips and tricks. So, with that
Sure.
being said, why don't you give us a little bit about you? You got the 2 letters in front of your name, DR, doctor. Where does
All
that
right.
come from?
So I studied health sciences in my undergrad. And I think like a lot of people who were really into biology, nutrition, biochem, like that was something that always really fascinated me. And I originally thought I'm going to be a doctor, like a medical doctor, maybe a surgeon. And then I shadowed a bunch of people who did those jobs and realized I really didn't want to do those jobs.
Why not?
Um, like partly because the hours are insane, especially people who work, like medical residents and surgeons. They're working these insane, like 24-hour, 36-hour. Like these people don't sleep. They're high stress, and I had a number of, um, you know, doctors that I had shadowed kind of tell me like this isn't a lifestyle that I would choose if I
Yeah.
had to go back. And so I still really wanted to help people. And the other aspect of that was I was realizing more and more that type of medicine, that type of doctor was really somebody who helped somebody once they were already really sick,
Mm.
or once they were already like really far down this road of dysfunction. And I realized that, in my own life, I was really into nutrition and working out and taking care of myself to try and do a lot more preventative and like to maintain function. And so I thought, okay, well, what can I do that's in the health field that's more in that vein? And so I ended up going to chiropractic college. I got my doctorate in chiropractic, and I practiced for 7 or 8 years in private practice and did a lot of other, not just like the hands-on care, which had its value, but also helping people with nutrition, with training, with mobility work, kind of like a very holistic approach to helping people to work on their health and wellness.
Cool. Very cool. Yeah, I think a lot of us, at least in the POTS community, we're really passionate about preventing disease rather than kind of dealing with disease when it gets to that end point, the bad part.
Mhm.
What about healthcare for you was so interesting about, like, I guess you're talking kind of about preventative medicine, like helping people stay healthy as opposed to like working with people when they're at the end, of health.
Yeah,
What about it was so important to you to actually work with people, like being a health coach basically is what it sounds like you were doing, besides being
yeah,
a chiropractor?
totally. I think it's like a big part of it for me is realizing that by the time you're at this like stage, if you haven't done the preventative stuff, it's a lot harder even to recover once you're sick, right?
Yeah,
So
yeah.
like if you're somebody who like needs, you've damaged your joints to the point where you need like a knee replacement surgery or something like that, like by the time you get to these end stages of disease where you have diagnoses and you're working with your kind of standard medical provider, it's a lot worse, and like you're kind of often so far down that path that it can be really hard to like turn things around, right? Like how
Yep.
like it's harder to exercise once your body's already broken down than it is to keep exercising and never get to that point.
Yeah, for sure. I agree. What inspired you to, you said that you did chiropractic for about 7 to 8 years plus the health coaching, basically, right? So what was like the inspiration to go from doing that to getting into supplements?
So I was always really into biochem. Like I
Okay.
did my graduate research project in biochem nutrition.
Sure.
I worked with a group where we looked at how different amino acids affect inflammation, and that was like what I did my graduate research project in. So
Cool.
like I've always been super nerdy into that. I was already like into that kind of like biohacker world of like trying different stuff and doing a lot of self experimentation for many years and all the way through when I was a chiropractor as well. And then I started actually having some injuries as a chiropractor.
Mm.
Actually, like compound of like CrossFit and chiropractic really wasn't a good situation for my shoulder, elbow, and wrist on my right hand, which is I'm right hand dominant, so a lot of the work I was doing was then starting to like break down my body, and I started to realize that my longevity in that aspect of care was going to be limited, and that I was starting to look to solve different problems for people or solve health problems differently. And then when COVID happened and everything closed for a while, I think like a lot of people, it was kind of that moment to be able to like take a step back and really assess what I wanted to do moving forward and how I wanted to proceed in my career path. And sleep was a huge thing for me during COVID and had become like really big even towards the end of when I was in clinical practice, just because so many people were coming in and in their initial assessments and stuff, just mentioning like, I can't sleep, I don't sleep well. Or even if they didn't mention it, they might have like noted on their form, because that was a question that we always asked. And it was like mind-boggling to me, because a lot of the people that I was working with were relatively like young, healthy people. Just where my office was, we had like a lot of young professionals coming in who were wanting to stay active and not have breakdown because of working on a desk all day. They weren't people who were like significantly injured or in this like disease state. And I was like, how is it that so many people who are supposed to be in the prime of their life are actually like missing this massive piece, right? Like a third of their life is like very frustrating and not working well for them, and they're feeling tired all the time.
Yeah, it's almost like it's weird because you can be in a disease state, it seems like, from just like not moving at all and then not getting enough sleep too. There's so many different like compounding factors, right? Like I think
Yeah.
oftentimes, at least it's my view, that when you're hurt even, right, that probably motion is lotion, right? And so a lot of people throughout COVID, they did a lot of things that were just not conducive to health. Like they stayed inside, they didn't really move much, didn't exercise, and on top of that, they were staying up super late. So many things, because they didn't have anything anywhere to be, any commitments to follow through with. So many things probably compounded and added to the issue.
100%. And it's like, I found even for myself during COVID, and I've always been somebody who's been super active. I worked a job where I was on my feet all day, like sitting a lot more, and just like not doing any of the stuff that normally helps you to cope or to have good mental health or to make your body feel good, right? Like leaving the house, being social, working out. Even it's harder to pursue like good nutritious meals in a lot of ways. Like sure, you can be at home cooking, but you're not, like, for me it's like going out, going to the farmer's market and going, like doing these out of house things, picking out my own produce at the grocery store, like that kind of stuff that we just kind of fell by the wayside. And one of the first things that my partner and I noticed was like, we're waking up in the morning and not feeling rested.
Yeah.
So actually for me, it was not that I wasn't sleeping, it's that I was sleeping for 8 hours and waking up in the morning and not feeling like I had slept at all. Like feeling like I could have slept for another 5.
So being in the biohacking world, what were like, you probably had you probably already had like ideas for sleep, or strategies for sleep. What were you doing in terms of sleep before that? Before you like created Thirdzy?
Yeah, so the things that I did before Thirdzy were most of the kind of standard behavioral stuff, like had blackout curtains, made sure there was like no lights or screens in my bedroom. I had blue light blocker glasses that I would start using in the afternoons if I was working on my computer, trying to, kind of like wind things down. Probably one thing that I wasn't doing well was sticking to a consistent sleep schedule. I was finding that I was a little bit more, sometimes staying up a little later to watch a show because I don't actually have to be up in the morning to go to the gym or, whatever. So that was definitely something I wasn't doing great. But, cool bedroom, lack of screens, dark, like all those things I was had already pretty much dialed in and was already tracking my sleep. Like I had an Aura ring that I've had for years, and then also I had a Whoop band at the time.
What do you like better between the Whoop strap and the Aura ring? Obviously, probably the Aura ring because you have it, right?
Yeah, so the Aura, and like, when we talk, if we get a little bit more down the road talking about like autonomic nervous function and heart rate variability,
Yeah.
it gives like a way better indication of what your heart rate and your HRV is through the entire course of the night. Whereas Whoop really gives more point data. And then, so they'll just say like, this is kind of like your average, and it takes point readings, and then it gives you a score. And I find the score difficult because, and this is a little bit nerdy, but for anybody out there who uses like sleep trackers that give you a score, pretty much all of them work in a way where they're comparing you to you over time, which means that if you're starting off and your sleep is like not great, that's what it's taking as your baseline. And so then over time, that's going to be kind of like your yellow or average scores. And then anything that you do that's better than that, you start getting into like the green, where it's telling you have had better sleep or better recovery. But then if your sleep gets better, then it becomes even harder to get green scores. So then the stuff that used to get you a green score now only gets you a yellow. And so we've actually had people, for instance, who've been like using our products who are like, I'm confused. Like I've been using it for a couple months and I was all in the green and now I'm all in the yellow and I don't know what's happening. And I'm like, that's because it's actually like your bar now for what good sleep looks like has been raised.
Oh, okay. That makes sense. Yeah, that's interesting. I never would have thought about that.
Yeah. And so I like the Aura because it gives you more of like your raw data. So you can see more of the picture of what's happening, and just, I kind of ignore the actual score that it gives me and just look at what is my actual data, because now I know what a good night looks like to me and like what my heart rate, HRV, respiratory rate, like what my good numbers are.
Got it. So in terms of HRV, so I guess we can take it that way right away.
Sure.
In terms of HRV, how, you see some people ask the questions of, is there like a specific number that you should be shooting for across the board? Like you see so many people get wrapped up in the idea of like, oh, my HRV is so much lower than that person's. Like I remember I had a Whoop strap for a little bit, and in the beginning of having the Whoop strap, my HRV was close to like 200, and on a day-to-day basis, and I'd be like, yeah, I got a better HRV than like everyone, right? Just because it was way higher. But then as I started to increase like my training volumes and life got more stressful, opening more business type of deals, it like plummeted completely, right? But
Yeah.
how individual is HRV? What's the variance? What's the difference? Should you compare it to other people? And then I guess if you could answer the question of how important is HRV to somebody that does have an autonomic dysfunction, and how it relates to that.
Yeah. So this, the general answer is like never compare your HRV to anybody else's.
Okay.
Like that's kind of like the general wisdom, which is like HRV is a very specific number to you. It's not exactly like a lot of other things that we have, like what a normal resting heart rate is, or what your triglyceride level should be, or your blood glucose should be. There doesn't seem to actually be a specific range that is like really healthy for everybody or really dysfunctional for everybody.
Sure.
And so, but like you were just saying in your own example, is like if you know that when you are not in a super stressed out period of time, when you're functioning well, your HRV is at 200, and then you're consistently, now your resting HRV overnight is at like a 50. Now you know that there's ways that your body is actually like struggling, and particularly your autonomic nervous system is struggling, because the heart rate variability is an indicator of the adaptability of your autonomic nervous system, or that part of your nervous system that is in control of resting and relaxing. So I'll just give like a really like basic. So heart rate variability is the difference in timing between your heartbeats, right? So most people, you listen to like the heart rate is like beep, beep, beep. They're not supposed to be perfectly timed. And actually, if you have very similar timing between your heartbeats, unless you're on a pacemaker, in which case they should be doing that.
Yeah.
Unless you're on a pacemaker, you should actually have a lot of flux in terms of the timing. And in fact, your heart should be like a little bit faster when you breathe in and a little bit slower when you breathe out. That's like in a healthy, like athletic person, that's almost always what you see. A little bit faster when you breathe in, a little slower when you breathe out. And it's this really great indicator that your body is adaptable, that your nervous system is really attuned to what's going on in your environment, and that your body is working really well. What happens when we get more stressed, more of that fight or flight, more cortisol, we're more amped up, more stimulated, is that we have less adaptability in the system. It's almost like when your body's in like go time, like when it's responding to stress, it's like, no, we just gotta like beep, beep, beep. Like it kind of loses its kind of go with the flow adaptability that it has when you're in like a more calm, relaxed, normal state. And when we're like healthy, our body should be able to get into that calm, relaxed, kind of flowy state every single night when we're sleeping. So what happens, and it's kind of a chicken or the egg situation, which is when we have poorer sleep, then we stay more in that fight or flight mode all the time. And if we have like a lot of stress that's going on in our lives, whether it's work stress, training harder than normal, eating crappy foods, relationship problems, like whatever it is, COVID, when we have more stress, then we also have trouble engaging that like rest mode more fully at night. So then it also tends to perpetuate itself into this kind of like ongoing wheel of my body's just staying in stress mode and not getting out of it.
Sure. Is there specific reasons why? Like, is it due to hormones or, dysregulation of the autonomic nervous system that people have that when there is more stress?
Yes.
Yeah. I mean, is that a loaded question?
Yeah. There are specific reasons why, but it's going to be different for everybody, right?
Yeah.
And what's interesting is that your nervous system is more of like a moment-to-moment regulator, right? Whereas your hormone system tends to be a bit of a more like, in some ways, a longer term regulator, right? Like you have patterns of like cortisol function. And when your hormones start to pump, they're going to have more than just like a couple of minutes worth of effect on your system. Usually it's at least a few hours worth of effect on your system. And they both play together. So if you're eating in such a way or emotionally responding in such a way that your cortisol is like super jacked, and then that can be exacerbated by insulin dysfunction, which tends to increase cortisol problems, then what you'll actually find is like that effect that it actually has on your nervous system feeds back so that it keeps you like in this elevated mode, where your nervous system should be able to pretty quickly start to regulate itself down. If you have cortisol and then it's, kind of like buddies and backups, which are epinephrine and norepinephrine, which are basically adrenal hormones, playing alongside it all the time, you're going to have a lot of trouble calming down and relaxing and having good sleep. And then it creates a cycle, because then if you don't sleep well, then what happens? You have more trouble with cortisol regulation, you have more trouble with insulin resistance, you have more trouble with elevated epinephrine and norepinephrine.
Sure, that makes sense. So yeah, this is one of the things that I tell a lot of my POTS clients to keep track of, and anybody that's in the forum or in our community, is I always say it's really important to track all the data in the beginning of like when you're trying to get better or like get into remission or get back to normal daily life, kind of for these reasons, right? Because you can see trends of the things that may disrupt your sleep. So like, for example, for me, I have an 8 sleep. It tracks the HRV. I don't know how accurate that is, but crappy food, if I do have a day where I go and eat fried food, which isn't often, my HRV drops significantly. And then I'm like, okay, my sleep felt like crap. I'm waking up. I feel like I haven't slept at all, unless I take Thirdzy. And then, so many different things happen. So I tell people all the time, it's like, keep track of everything that happens throughout at least a week, a 7-day period, and see what your symptoms are like, or see if your sleep has been disrupted. That way you can like kind of pull away or bring things in that may be necessary.
Cool. That makes total sense, right? Because we get into these like patterns. And the cool thing is that there are so many inputs that create the pattern, but that means there's so many different inputs or levers you can pull to get out of that pattern too, right?
Yeah.
Like for some people, it's definitively exercise. For some people, it's diet. Like we all kind of, I think, have different places where we can excel in figuring out how we're going to like change what's going on with us. Some people are like great at like, you know, taking a rest day, doing some meditation, like doing whatever they need to like kind of like take a time out and then get back into it. And then if you can start to interrupt that pattern, that is like the opening to then start to make everything better from there.
Sweet. So, hey, in terms of, I want to touch briefly on POTS, just a little bit.
Yeah.
In terms of autonomic dysfunction, the autonomic nervous system, what are some things that, if you can speak to this, what are some things that could cause autonomic dysfunction? Basically, what I do with people with POTS is I focus more on the exercise aspect, nutrition, hydration, strategies, things of that nature. Because personally, what I have noticed is that, you know, POTS is defined by, you know, your orthostatic numbers. Basically, like if you stand up from sitting down, your heart rate shoots up 20 beats per minute and your systolic blood pressure drops by like 30 points or something. And my theory is, the way that I kind of go about training people is, I want people to understand that your body is resilient, it's capable, and it makes adaptations. So
Yeah.
if you get diagnosed with POTS and you are to sit around and lay around forever, you know, and there's the extreme cases where people have syncope and they pass out, you know, once in a while or often. But it's my opinion that you need to slowly create change so that your body makes adaptations, because it is resilient. It can make adaptations to the demands that you put on it, even in a chronically ill state. My opinion, this isn't medical advice, remember that.
Sure.
So what I do is I start really slow with exercise and like maybe recumbent biking or rowing, and then, you know, try to make the adaptation to be able to go from sitting to standing and doing cardio like that. So with all that being said, what are some reasons that somebody could have autonomic dysfunction? And does what I just said ring true to you? Does it, you know, does it seem legit?
Yeah, like that actually makes total sense, right? I mean, autonomic dysfunction is basically kind of a fancy way of saying like your body's not adapting super well right now,
Sure.
right? And so then when you're trying to help somebody like get back to exercise, like the things that you're saying is like recognizing like you're not broken. You just have like a smaller range right now of what you can like put up with, what you can, you know, what you can adapt to, and then you can grow that range just like you can grow your, you know, pain tolerance, or you grow your endurance. It can take some time. And typically, you know, a lot of people who have been diagnosed with POTS, you'll often see that there's been some sort of like significant stress experience in their life, whether it's some sort of, you know, deep like emotional loss, or, you know, other just like period of like really like stressful, a lot of stuff going on in their life. Like that like precipitates this then decline in this like ability to even cope with things like going from sitting to standing really quickly. Their body is like, it puts you in this almost like overstimulated, hyper aware, hyper vigilant state.
Yep.
And so I think for most people, it's starting to recognize like what are those things, and it's really easy to downplay, I think, especially emotional, psychological stress. And even though we talk about mental health a lot, like I've been through periods of my life where I had like some significant digestive stuff going on, and I went and I got all the tests and food sensitivity testing, all this stuff, and I had a naturopath say to me like, "Have you considered that this might not be diet related?" And I was like, "No, like it has to be diet related. Like there's no way this isn't having something to do with my food." And she was like, "Well, maybe it's stress." And I was like, "No, there's no way.
Yeah.
I'm not that stressed." And then, you know, some things changed in terms of my living situation, my relationship situation, and all of a sudden, magically, I didn't have these digestive issues anymore. And I realized, oh, all that, just because it felt normal to me doesn't mean it wasn't stressful.
Yep.
And so I think when we're looking at autonomic dysfunction, it's not really a dysfunction. It's the fact that your like body has been constantly responding to stressful situations, whether or not you're really thinking that they're stressful or not, to the point where it's now kind of like running out of bandwidth to address any kind of stress appropriately.
Yeah, 100%. I think something that is the common trend among people with POTS is when they go to the doctor, they go to the hospital because they think something life-threatening is happening. They always tend to say like the doctors gaslight them and they're like, it's anxiety. And I try to be the orator of like being the person in the middle, where it's like, it can be that you're having these symptoms that are POTS, and the symptoms can be real. You could be having trouble breathing. You could be having syncope, all these different things. But it can also be that you're having anxiety and you're having panic. The two don't have to be like mutually exclusive, right? Like they can go together. And oftentimes the disconnect between the medical community and the actual patients for people with POTS is that neither kind of wants to bend towards each other. They just are kind of clashing all the time. And so for me, what I try to tell people, and part of the message that I put out there is, look, a lot of times you do see mental health issues with people that have POTS. It is what it is. And I think oftentimes too, we look at something as, I'll give you an example. So like you could be having this anxiety because you felt the symptom or whatever. And then what that does is you felt the symptom, you get anxiety, and then suddenly the anxiety gets worse, so the symptom gets worse. And then it's kind of like the chicken or the egg thing, right? Like you don't really know what is causing what, you just know that you're feeling all these things, you know?
Totally.
And so what I try to tell people is like, look, you have to address all things. And just because you don't think it's anxiety doesn't mean that it's not anxiety. And also just because you don't think you went through a stressful period of time doesn't mean you didn't go through a stressful period of time. And so many people think that they know how to cope and, you know, certain things weren't stressful to them when really, like, in the back of your head, it could be.
Yeah. And I kind of have like two thoughts around some of the stuff you were just saying, which is like, sometimes getting a diagnosis is so relieving because it makes you feel like you're not crazy. You're like, this is like a real thing, right? And it makes you feel like whether you're talking to like your friend, like a friend, a partner, like your parents, like whatever, like, see, there's a thing. Like I wasn't making it up.
Yeah.
But I think sometimes when you're having tests done and you're like, no, this is happening, and they're like, well, your tests are all coming back normal, and it's not, you know, you don't have hypothyroid and you don't have, you know, any problem with like your echocardiogram or like whatever, and then you start to feel like maybe I'm just crazy. And it's like, well, you're not. But at the same time, it doesn't mean that things that are going on with you, like you said, like psychologically, aren't creating like real, actual physical manifestations of, you know, some process that's indicating that your body's not doing very well, right?
Yeah, there's that psychosomatic portion of it. Like
Totally.
your brain can absolutely cause symptoms in real time.
Yeah, like 100%. They're connected, right? And then stuff that's going on in your body can make your brain feel not good and make you, you know, can cause additional like depression, anxiety, overstimulation, like all the other stuff.
Yeah.
Oh, there was something else that I was going to, and it just went out of my head.
That's okay.
All right.
Yeah, you're good. You're good. I think, we'll walk away from the POTS thing a little bit, because sometimes I think though too, like you're right when you say that sometimes getting the diagnosis can make people be like, gosh, I'm not crazy, and it's like a weight lifted off their shoulders. But also on the other spectrum of things, and you don't really need to touch on this much because I don't know how much you've actually dealt with people that have POTS. I get inquiries every day for coaching, right? And sometimes sometimes what I see is like, not only is it a sigh of relief that they have this diagnosis and they're being heard, but it can also be like, I have a reason that I don't need to do certain responsibilities now. And I think that that's not just exclusive to POTS, that's exclusive to a lot of different health conditions, right? They're like, finally, I have a reason that I don't have to go to work, you know, and so that I don't have to contribute. So anyways, we'll walk away from that a little bit. Let's talk about why sleep. Why did you get into sleep supplementation, and why is it so important to you? Why is it important for autonomic reset, basically, or making the autonomic nervous system healthier?
Yeah. So the supplementation and why I kind of went down that road, you know, kind of go back to what I was talking about earlier with, you know, COVID, and also when I was in practice seeing tons of people who weren't sleeping well, is like, it's actually really related to what we were just talking about like the brain and the body working together, which is that like it's really hard to change the mind with the mind. Mm-hmm. Right? So a lot of people, when they're not sleeping well, they'll kind of try to like white knuckle through it, right? They're like, okay, well, I'll make my room darker, I'll get a different mattress or whatever. And then after that, it's just like, it becomes this game where they're trying to like will themselves into better sleep. Yeah. But the thing is that our sleep is also an autonomic process, right? Mm-hmm. It is a process that is not consciously controlled.
Yeah.
And so when you're trying to create a change in this habit that isn't actually consciously controlled, it can be really difficult to do that through just trying to like willpower yourself into it.
Well, and that can cause anxiety, right? Like, so many people watching this have probably had that problem where they're laying in bed, they're like, shit, why can't I sleep? Why can't? And then it's just like, it's 5 a.m. They're like, oh, I got to go to work.
Yeah, you start doing the math, like, okay, if I fall asleep right now, I'll get 6 hours of sleep.
Yeah.
Okay, right now it'll be 4. You know what I mean? And then and you keep yourself up. And what actually needs to happen for most of us to actually get better sleep is to start changing what's happening in our bodies.
Mm-hmm.
And then when you start to change what's happening in your body and your biochemistry, that can like feed up to this mental process that we call sleep, which is also like a full body process of recovery and emotional regulation and memory consolidation and kind of like cleaning out disease process and rebuilding all of your tissues and like all the stuff that happens at night that's so important. And I think I got particularly interested and excited about sleep once sleep trackers came out and hit the market, because it opened up this new conversation around this aspect of our health and our lives that we've largely ignored. Okay. Like 30 years ago, doctors, science pretty much thought the point of sleep was to not be tired. Yeah. Right? We had like no idea what was happening at night while we were sleeping. And now we have a lot better technology, and there's been a ton of research, and there's still some really unknown, like big unknowns around sleep and sleep regulation and sleep process. But we know enough to know now that it actually has a huge effect on every aspect of our health. Yeah. Like everything from, metabolism to mental health to autonomic function to muscle growth, fat burning. Like literally there isn't any single thing that your body does that isn't impacted by what happens at night while you're sleeping. And we now know also that there are some parts of your brain that are even more active while you're sleeping than while you're awake. Mm-hmm. And so when I started to go down the rabbit hole of understanding my sleep and recognizing that it wasn't that I wasn't sleeping, like I was doing that part, I was unconscious, my eyes were closed, 10 to 6, but then I was waking up and not feeling good. And I was like, okay, well, this is a process. There can be inputs into this thing to make it better. And how do we do that? And what can I take to do that? And then I realized that there's like very little out there, like virtually nothing out there that was geared towards that. Yeah. In the, kind of pharmaceutical world, there's a lot of sedatives, which will take away the frustration of not sleeping, but it also turns everything off. So then those processes that are supposed to be super active, so you actually feel good and benefit from your sleep, aren't happening at all. So if anything, it actually like makes your health and well-being worse. And that's definitely been what the literature has fleshed out for us now, is that if you're taking sedatives at night, whether it's non-pharmaceutical sedatives like alcohol or pharmaceutical sedatives, like your health gets worse over time because it's interrupting your sleep processes.
Yeah, it prevents like the REM sleep, the deep cycles, things of that nature. Yeah.
Yeah, electrical activity, like the cleaning process of the cells in your brain, like all that. This was a crazy thing that I learned. So you know how when you drink alcohol, you can have memory loss, in that like sometimes if you're drunk, like you don't remember what happened during that
blackout or the brownout.
Yeah, exactly. Like if you black out, you just like you have memory loss.
Yeah, 100%.
And so any kind of sedative that you take before bed can cause you to have memory loss. So like whatever you did the night before, whatever, you're probably not going to have well consolidated memories of that in the future. Yeah. But also, sedative use before sleep can cause you to have memory deletions, where your brain, because your brain like reorganizes itself while it's sleeping, can actually cause you to have deletions of memories from like not even the time around when you were using those substances.
I had no idea about that.
Mind blowing. Yeah. Wow. Really insane. Yeah.
Maybe that's why I don't remember anything ever.
Yeah. I'm like, oh, my childhood's just gone now.
Yeah, that might be due to quite a bit of other things.
For that though, so. So I got really into it when I started to realize like how impactful it was. Yeah. And then, on the supplement side was, okay, how can we take something that's going to affect our bodies to help us do these processes better and not just like knock us out at night? And there was like, I couldn't find anything that I wanted to take or use that actually did that. And so ultimately that's kind of what led us to starting Thirdzy.
Cool. So I was going to ask you what you think the most important pillars for sleep are, but because we're kind of going down the road of the supplement stuff, let's talk about the formulation of Thirdzy and why you chose the ingredients that you did specifically. I know that there's a couple questions from the forum talking about like, you know, ingredients, magnesium biglycinate versus L-threonate, things of that nature. So yeah, why don't you tell me first, let's talk about melatonin briefly. Why is melatonin not in the product? I used to take a company called Beam, the CBD, you know, all that stuff. And I took it, I remember I took it one time, the full dose, and I think it has 5 milligrams of melatonin. The reason why I put air quotes up is because there's a big discrepancy between what is actually labeled on supplement labels with melatonin and what actually might be in it, too much or too little, from what I've heard. And so I remember I took it one time. The next morning when I woke up, I had the craziest brain fog I have ever had for 5 hours after. And I was like, oh, hell no. So then I would take like half a scoop and it was okay, but it's still never like made like the melatonin thing, the melatonin component. I'm just going to leave it here. Just didn't do it for me. It didn't work. CBD, I really enjoy supplementing with CBD, but the melatonin part didn't do it for me. So why no melatonin in your product?
Yeah, great question. Melatonin, a lot of people think it's super safe because it's like natural. A lot of doctors will recommend it because it's natural. And the thing is that taking melatonin every single night, while it may be naturally sourced, is not natural, right? What's natural is for your body to produce its own melatonin. Sure. And melatonin doesn't actually improve your sleep processes. It just improves your sleep timing. So there is use case for melatonin. Use case for melatonin is like if you're jet lagged, if you're a shift worker and your sleep schedule is all over the place and you really need to coordinate your sleep timing. Cool, melatonin can be used for that. Also, most people take way too much melatonin, and most products are dosed with too much. Like 5 milligrams is actually a massive dose of melatonin when it compares to how much your body actually produces. And some of the research with melatonin actually shows pretty good effects. It's starting at like 0.3 milligrams of melatonin.
Yeah, I was just going to say, isn't like the actual research dose like 5 micrograms or something? Like something really small?
Very small. Yeah, so you don't actually, and so that's the thing is like all of your hormones play together. And so right off the bat, for me, like understanding how the body works, the idea of taking a hormone all the time, like we know this from like hormone studies in every single other area, right? If you start taking testosterone, your body stops producing testosterone. If you start taking a ton of estrogen, your body produces less estrogen. So and it's interesting because you know, there are people say like, oh, well, the melatonin doesn't work that way. Like you don't have that negative feedback loop. And that's actually not entirely true. And it's one of the reasons why people who start taking melatonin start taking like 2 milligrams and then they have to take 5 milligrams and then they have to take 10 milligrams. And like I've met people at events who've come up to you and they're like, yeah, I take like 40 milligrams of melatonin a night. And I'm like, oh, that's
not good.
Like, right? And then they're like, now if I don't take it, I can't fall asleep.
Yeah.
And so the challenge with melatonin is that all of your hormones play together. Melatonin doesn't only control sleep timing. It also has significant, it gives your brain cues around seasonality, time of year. It communicates with your sex hormones. So like, for instance, species that only mate seasonally, the thing that suppresses their fertility is actually having really high levels of circulating melatonin.
Wow.
So when you start to look at what else melatonin does and how it impacts things like species that hibernate and put on a lot of body fat to hibernate, part of the indication for that is elevated levels of melatonin. And then it's like, is this something that we really want to be taking every single day? And there are studies that are starting to point to these things actually being like, all right, there are metabolic changes, there are impacts on other hormones, and that for me wasn't something I want to take all the time. And when we talk about pillars of sleep, because I know you like touched on that and we kind of blew past it, but like consistency is the the most important thing for sleep is consistency.
Yep.
So if I want to add in supplements to support my sleep, I want something I can take consistently to help those processes to occur all the time. And I want something that's going to be hormone safe. And I want something that's actually going to work to allow my body to do the sleep processes it's supposed to do itself instead of doing it for it.
Sure. Yeah, that makes sense. I think there's so much to touch on there in terms of like consistency. Number one, I think is super important too. That's something that I tell a lot of my clients. I even touch on with this channel sometimes is consistently doing anything is going to work for the most part, right? So even your wake cycle, your going to bed cycle, like if it's all over the place, if you're waking up at 9 a.m. one day, 5 a.m. the next day, 7, whatever, and going to bed the same way, you're going to have a lot of dysfunction there and your body's not going to make the adaptation, that's the best word that I have, in order to let you fall asleep and wake up at certain times without feeling, tired or whatever. And in terms of melatonin too, I think that so many people don't understand that melatonin is an actual hormone. It's just kind of this thing that's thrown out there as like, it's a supplement, you can take it for sleep, it's super safe, it's efficacious, all these things. But people aren't realizing that when you brought up, when you said, using exogenous hormones, I was going to say TRT right away. You said testosterone. Yeah, there's umpteen thousand pages of research that talk about once you start taking TRT, your testes stop producing testosterone themselves. And can you get it back? It's like, there's dark waters there about how you do it and if you can. But yeah, anytime that you take something exogenously, it's probably more difficult for your body to develop it by itself.
Totally. And then once you start looking at dosing amounts, like your experience, the reason you felt so groggy in the morning is because that amount of melatonin for you was way too much. So then you super overshot your sleep cycle, and then you are trying to get up in the morning and now you feel like absolute trash, which is antithetical to what you're trying to do, right? Like nobody really wants to sleep. Everybody wants to sleep so you actually feel good in the morning. So if you're taking something to sleep that makes you feel like trash in the morning, we've completely lost the thread there, right?
Yeah, totally. And yeah, I think too, like you can overshoot sleep too, right? Like my sweet spot seems to be about 6 hours, but it has to be within a certain time window, like 10 p.m. to like, I don't know, 5 a.m. That's not 6 hours. Is that 6 hours? It's close to whatever.
Yeah, it's a little later actually.
Yeah, it's a little bit later, but like the consistency part, right? And everybody has like a sweet spot, I think. So, anyways, touching on melatonin, what do you think? Like the one main thing that you want to get across about melatonin? What's the, I guess, issue for lack of better terms?
The issue with melatonin is using it all the time.
Okay.
Like if you use it once in a while, you take it to Europe with you so you're not jet lagged, great, do that. Send it. As long as it doesn't make you feel like, can I say shit?
Yeah.
As long as it make you feel crappy in the morning, that's fine. But if you're looking for something to actually help you establish like better sleep habits and to use on a regular basis, that is not the option that you want. It is like you want to rely on something that's hormone safe.
Cool. Yeah, I have another guy. His name is Dr. Tyler Panzner. I don't know if you know who he is. He's like a genetics scientist. He was trained in pharmacology. He's coming on sometime next month. He has a little bit different of opinion than we do on melatonin, so I'm kind of excited to hear about that. But maybe I'll send you the clip once he talks about it.
Cool. So there's other research that has been done on melatonin for stuff like impact on different disease processes, cancers, stuff like that, where they've actually like used it to see like changes in other things happening. So I'm not saying holy melatonin's terrible, never use it. Yeah. I'm just my perspective is that it has like specific use cases, and right now most people are not using it in a way that's actually appropriate. Like if you're looking for something to help you get better quality sleep, it's not going to do it. Right? Like even the research on melatonin, I think the statistic significance is that it gets you an extra like 4 minutes of sleep a night or something like that. Like most people want more than an extra 4 minutes of sleep a night. And it's not going to help you create strong sleep spindles. It's not going to help you get more deep and REM sleep. Like unless the main thing for you is that you cannot fall asleep. And even then there's other ways to help in, with sleep onset. I think that people are like really overusing that as a tool when there are other options out there that are better suited for what you're looking for.
Sure. Cool. Well, thanks for that. Let's talk about what are the ingredients in your product, and why do you have those specific ingredients, and why in the doses?
Cool. So there are 4 active ingredients in our product. The collagen is the base. So it has 10 grams of collagen. The collagen helps with joint and muscle recovery. So for our athletic population or people who are working out, that can be really helpful just for like the tissue recovery aspect. But there's also in the collagen, there's 3 grams of glycine, and glycine helps to lower your core body temperature, help you get into better deep sleep, and improve sleep architecture, which is basically like the electrical activity in your brain at night. And then the other 3 things that are in it are L-theanine, which helps to counteract overstimulation, Gaba, which is your main brain chemical for calming down and staying asleep, and magnesium bisglycinate, which is a mineral that I think most people have heard of that really helps to calm down both your nervous system and your musculature.
Cool. So I think the question there is probably going to be why, because Andrew Huberman's out there saying, you need to take magnesium L-threonate. And I loved magnesium L-threonate personally. I used to take it in the morning though for focus as opposed to pre-sleep. Why magnesium biglycinate rather than L-threonate?
Sure. And actually, Huberman does actually recommend either L-threonate or bisglycinate.
Oh, okay.
If you go through, I mean, I've listened to like everything the dude's ever said, so he does actually recommend both.
Are you buying his book?
Pardon me?
Are you buying his book? Did you see he's releasing one?
Oh, I didn't know he was releasing one. So
the book is called Protocols.
Cool. You know what? I'm gonna buy it, even if I wasn't excited about the content, which I will be. I would buy it just to support the guy because I've gotten so much value out of the information he puts in the world.
Yeah, he's so cool.
Yeah. But okay, so the big difference between magnesium bisglycinate and the magnesium L-threonate. L-threonate is actually a compound that was developed at MIT, and it's a patented compound. It's also a massive molecule. So the serving size when you're taking threonate is pretty big. Have you ever bought it, like the capsules?
Yeah, I have a bunch of capsules in my house. Yeah.
Yeah, they're big, right? The capsules for it?
Yeah, they're pretty big. They're horse pills. Yeah.
Yeah, and like typically when you get a bottle of the capsules, it'll be like serving size 3 of these horse pills, and even that is only 125 milligrams of elemental magnesium.
Can we touch on that? The difference between magnesium that's labeled and then the elemental magnesium.
Sure. Yeah. So usually, almost always, what you'll see on a label is it'll be like, so for our product, for instance, like 250 milligrams of magnesium, and the source is magnesium bisglycinate. So it actually was like, I think it's about 1.4 grams to get to that 25 milligrams, even with bisglycinate, because bisglycinate is still a large molecule. So you actually have to take a lot of the molecules of like amino acids attached to magnesium to get to the elemental amount of magnesium. And almost always when you see it on a nutrition label, the amount that's labeled is the amount of elemental magnesium you're getting, not the total amount of compound.
Okay, got it. Okay.
Yeah.
Sweet. Okay, so then L-theanine, let's touch on it just like a little bit more. Why L-theanine and Gaba too, I want to talk about. Something that Dr. Tyler Panzner told me. He was a geneticist guy that I worked with to like get some of my health stuff in check. He wasn't a fan personally of Gaba. I actually really liked it after taking Thirdzy. He didn't like it that much because he said for some populations, with certain mutations, it can like convert to glutamate, and then that can cause people to like kind of be more wired. Have you had that experience, or do you know anything about that?
I actually don't. I'm gonna look that up because I actually feel like the glutamate pathway is separate.
Okay.
But I will look that up. I know that like most of the, what's the word I'm looking for? Kind of like controversy around GABA is more about absorption of GABA because it's a pretty large molecule.
Sure.
So there was a while where like people were saying there's no point in even taking GABA because it's too large to be digested and it's too large to cross the blood-brain barrier. But we actually now know 2 things. One, we have transporters to cross the blood-brain barrier. Like they've found transporters for GABA, so we know that taking in external GABA can get into the brain. And then 2, most of your GABA actually is created and used within the gut. And so replacing the GABA in your gut then also like has a sparing effect where then you have more available to your brain for things like sleeping and regulating anxiety and all the other things that GABA is really good for.
Cool. Yeah, and for the record too, like besides me, I have a bunch of friends that take GABA as a supplement, and they all have success with it. Like they all really like it. So, why the amount of GABA that's in your product?
So we our formula is matching up with what is being shown in the literature to have effects. So when you look at studies and it's like, okay, how much did they use in the study for how long, and then what was the effect that they got? With GABA, there's actually a huge range. So the range for sleep is like from 100 milligrams to about a gram.
Wow.
And so we went on kind of the lower end with 300 milligrams, but still significantly more than a lot of kind of, you can get little capsules where they'll pixie dust it and it'll have like 50 milligrams. Like that's probably not going to do a whole lot for you.
Yeah.
But yeah, with GABA, and then there are some studies for GABA and growth hormone, which like the correlation there is also with deep sleep, where the people are taking like 3 grams of it at a time. So the safety bandwidth for GABA is pretty wide. And then in terms of dosing, we wanted to go with stuff that has been shown in the literature to definitively have effects, but go on a range that's kind of lower, especially because people can always take more, right? Like dosing's really difficult too, because you'll put something in a product and like you and I have different metabolisms, different body sizes, different stuff going on, where if we both take the same scoop, like it's going to have a slightly different effect as well. So we're also trying to put something that's middle of the road for a wider application as well. Yeah.
That makes sense. Yeah. Do you have people that take more than 1 scoop of Thirdzy? Like, have you heard of that?
Yeah, we've had some people reach out who are like, hey, I weigh 250 pounds and I train like several times a day. Is it okay if I do a 2 scoop? I'm like, I mean, yeah, like I'm a 130-pound woman and I take a single scoop, so there is some play in there. And that's another reason why having a powder is nice, because if it's just in capsules, it's harder to like grade your dosing. So I do recommend often for people like, you can start with even a smaller scoop, like start with half, and if that's doing well for you, like take half. And then if that's, you feel like you want a little more or whatever, like you can always go up from there.
Yeah. So, is it safe to say that Thirdzy is more of a, because there's no sedatives in it, is it more of a like keep you asleep type of supplement, so you actually like enter those deeper realms of sleep? For me personally, that's what Thirdzy does for me, is like I'm able to actually, unless I have to pee for some reason like super bad, then I'll get up. But for the most part, I find that I get deeper sleep. And also, well, I'll get into this after that. But is that kind of what the idea behind Thirdzy is?
Yeah, so we didn't want sedatives in it because we want your brain to be active at night. Yep. So the big thing with it is you're not going to feel that, like, as you said, you don't feel that like hard push, like that sleep pressure of like, I'm going to pass out immediately that you would get with a sedative. A lot of people who take it do say they feel like more calm because, the L-theanine and the GABA, they do actually help your brain to wind down, counteract overstimulation, help your system to calm down. But you're not going to feel that hard sleep pressure. And then the idea is that whether you're getting 6 hours or 9 hours, that you're going to get the most out of those hours, because now you have like nutrients and amino acids that are supporting your brain to do what it needs to do at night. More deep sleep, more REM sleep, stronger sleep spindles, more amino acids available for rebuilding, like to have more sleep efficiency. And then also like, yes, definitely do like deep sleep well, do REM sleep well.
Sweet. Yeah. So I've noticed that taking Thirdzy, because I've taken glycine by itself before too. But taking Thirdzy or glycine in general does actually have a little bit of a sedative effect on me, because I run pretty hot at night for whatever reason. And taking the collagen or glycine by itself, it makes me like just kind of cool down and have that, with Thirdzy specifically, more of a calm mindset. But the fact that my body temperature comes down to, I think, kind of puts me out.
That's great. I love that. That's good to hear.
Sweet. So I know we're kind of running out of time a little bit. So I just want to go over a couple things, if you're cool with that, if you got a little bit of time.
Sure. Yeah.
So success stories. Give me some success stories. I'm going to tell you one that I really like. So when I first met my girlfriend, she had trouble sleeping, and I was like, oh, I got this Beam shit in my cupboard. I don't want it. So I gave her the Beam, and that was like one of the things that actually helped her fall asleep at first, but then Beam didn't really work so much. You have the melatonin effect, blah, 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 blah. Then we talked to you guys, and we had tried Thirdzy. And Thirdzy has like completely changed her sleep, like completely. She's actually right there right now. I think that she actually started to have dreams again
That's
with
amazing.
with Thirdzy.
Yeah, I
So
love it.
yeah, so we have some success stories, and then some of my clients have actually ordered Thirdzy via our code. I hope it's with our code, but yeah, they've ordered it too, and they've only reported back good things. Yeah, so if you haven't ordered with our code, order with our code right now. You'll see the banner on the YouTube thing. Yeah. So what are some of the like best success stories that you've had with the product?
It's actually really cool. We have sometimes people come and like reach out and they have like things going on that I'm like, I can't even, I didn't even know that was gonna be that good, kind of thing. And some of the cool ones are like the dreaming again is big, and that was actually one for me. I never used to dream, and I thought that I just like that was normal. No, 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 no. You're supposed to sleep, or you're supposed to dream every night when you sleep. You don't always remember, but you are supposed to dream.
Right.
And so that was something that like came back for me actually. So like personally, that was huge. But like we had a review recently with somebody who said that they had slept through 6 hours consecutively for the first time in over 18 months after the first night they took it. And the review was like actually kind of funny because they were like, okay, so I took it a second night just to make sure it wasn't a fluke. And I did it again.
That's like, awesome.
Yes, that's amazing. That's exactly what we want to hear. And we typically also hear a lot of people who have tried melatonin, wanted to have something natural that actually works, but that wasn't melatonin. And that we get a lot is people who are like really skeptical of like, if there's no melatonin in this, how is it actually going to help me sleep?
Sure.
And then also a lot of people who have fewer sleep disruptions. And like my thing is that you will potentially still have sleep disruptions, like wake ups in the night, even if you have good normal sleep. Like good normal sleep, you go in these cycles where you go like, you know, light sleep, and then you drop down into deep sleep, and then you come back up through light sleep, REM sleep, light sleep, and then you go back down into deep sleep. And having those like little points of like vigilance or wake up is actually totally normal. The big thing is how quickly you can then actually like drop back into sleep. And so for especially menopausal women, I've had a ton of menopausal women who have tried our products because they're like, as soon as they hit that age, they started having like major sleep disruptions because their hormones are all over the place. And the report is not, I completely sleep 100% through the night and never wake up, but it's actually, I'm feeling better in the morning and I'm able to get back to sleep quicker when I do wake up.
That's great.
And so for me, I'm like, perfect. Like that's what good sleep sounds like.
Yeah.
I would almost be more worried if people were coming back and being like, I'm laid out. I never like hours completely gone from the world. I'd be like, maybe we need to take down some of the dosing. Yeah.
Yeah, that's awesome. That's great. Okay, cool. Well, hey, I want to ask you just a couple questions from the forum, if that's cool with you. So let me look on my iPad really quick. We touched on magnesium.
Yeah. Oh, actually, I think I didn't quite finish. So the big difference is the two amino acids. Bisglycine is attached to glycine. Glycine has really good uptake across the blood-brain barrier and has the glycine, which also has added inhibitory and neurotransmitter effects, which help us sleep. And the L-threonate actually also has really good uptake into the brain, but it has slightly different function because it's not attached to the glycine. And I really like doubling down on the glycine pathway. That was the difference.
Cool. Yeah. Awesome. All right. So let's see. Let me pull this iPad out. Oftentimes, the normal hygiene habits don't suffice for people with dysautonomia. Are there unconventional sleep tips and tricks you can share with us? Well, I'm guessing she's saying for people with POTS, but we could just talk about in general. Are there any unconventional sleep tips that you have found are helpful?
Yeah, this one is like straight from Huberman, but I found it really helpful for me, which is getting really bright sunlight first thing in the morning. And then also, if you can, getting sunlight when the sun is going down. Those actually really communicate to your brain that's the timing around sleep and help you to coordinate day and night better. So if you do have, health reasons or whatever, that your body is like not super in a good rhythm, that can help you get back into that rhythm. Cool. And then I know a lot of people, instead of if they are unable to have really consistent timing with their sleep, they create certain habit cues that help them to get to sleep. Like they listen to the same playlist when they're falling asleep every time, and they do the same things in the same order. Like whether it's like I wash my face, I turn off this light, you actually create physical cues that help your body to know sleep is coming now.
Yeah.
And then the other thing that I would mess around with for people who otherwise have more difficulty around controlling their sleep timing because of whether it's because you have POTS or because you have a job that requires it or whatever, is meal timing. If you always finish eating 2 hours before you go to bed, whether that happens at 7 p.m. or 9 p.m., your body will still be able to kind of like have a better trigger around falling asleep if you also use other physiological inputs to prime those habits, basically.
Yeah, kind of like what we talked about before, consistency, right?
Yeah.
Yeah, sweet.
Yeah.
Okay, so let's do, what are some of the best and worst activities to do before bed? You mentioned viewing sunlight. I have a question on that, I guess that might add to this.
Yep.
Do you think you need to actually see the sun, or is it just the sunlight, like sunset, while you're going to bed? And then what are some of the worst activities? I guess something that I would say
Don't
is...
stare at the sun.
Don't stare at the sun.
Don't stare at the sun.
I think something that, maybe I've recommended to people is don't do like a HIIT session before bed, some sort of like HIIT cardio. I find that that's just kind of ramps you up, especially if you do have POTS. Zone 2 cardio I have found for myself to actually help a lot with getting to bed. So yeah, what are some things that you think that you should and should not do before bed besides looking directly at the sun?
Yeah. Looking at the sun is kind of irrelevant. It's actually the part of your eyes that pick up the brainwave or the light frequency that actually communicates timing to your brain are not visual. So you don't actually have to look directly at it. You just have to have like your eyes in that direction in general. So like in the morning, face towards where the sun is coming up, so like towards the east, and then when the sun's going down, you want to be kind of like facing more towards the west. And the like red light that you get in the evening is super helpful. Apparently, a lot of people, speaking of good things before bed, red light therapy is actually supposed to be quite good for helping with sleep as well. I haven't tried that, but I've heard and I've seen some studies showing that red light therapy can be really helpful. I would specifically avoid anything that falls into the bucket that we'll call stimulating. And so that can be exercise, that can be certain types of media, like maybe don't watch the news right before bed, because I know a lot of people find that emotionally stimulating.
Yeah.
Even avoiding having conversations with certain people, like legit, there's certain members of my family that I would rather talk to in the morning. Just because I know that sometimes we're going to get into conversations that are just going to be like more
heated,
stimulating, and then things like some people find sauna very helpful for sleep. I actually find doing a sauna before bed too stimulating. It gets my heart rate up.
Really?
I get like more awake. It's actually not something that I love, but shower, on the other hand, I find really relaxing and like helps me to wind down. So I think there is some individual variation too with like how you perceive an event matters. And so trying to avoid, and then stimulating as well is going to be like big meals, a lot of sugar, that kind of thing is also probably stuff that you want to avoid close to bed. And then things that you want to do is stuff that you find mentally and physically like relaxing and restorative. So listening to things that you enjoy. I love putting on an audiobook to fall asleep to. That's kind of one of my go-tos. A lot of people do like to read before bed, especially with dim and or red light, not white or blue light. Some people find sex very relaxing before bed. Some people find it more stimulating. So depending on what camp that falls into for you.
Right.
Those are kind of my go-to, like do activities and then don't do activities.
Sweet. Awesome. So to touch on the blue light thing really quick, there was also asked, how much does not exposing yourself to blue light actually matter for sleep? I'll talk real quick on my personal experience with it. I don't find that blue light really matters for me. I used to wear the blue light glasses. I think mostly just to kind of be the cool guy who wears blue light glasses, rather than whether it actually helped or not. So yeah,
Yeah.
if you want to touch on that real quick. Also, what you said about reading a book. For me personally, I read a minimum of 10 pages right before bed of some sort of book. I find it really relaxing. Also, it like stimulates the brain, but in a good way, I guess, not
Mhm.
so much like an active way. And for me, learning before bed, for some reason, maybe you can speak to that, like has profound effects on my memory and recall.
Yes.
So
Um,
blue light, blue light.
yeah, blue light, and then we'll come back to reading and memory, like learning before bed, because that's an interesting thing. Um, Blue light, I think there's a big range of how sensitive people are to it, and it also depends on like what season you are in your life as well. So people who are already not great at producing their own melatonin are going to be more sensitive to it. And you can see this with kids, right? Like your kids probably fall asleep watching TV.
Yeah.
Blue light could not matter less to them at that point, right? Because kids are like, their brains do melatonin really well.
Yeah.
In general, although obviously like we see increasingly like more and more kids who are having health challenges and are less attuned to sleep-wake cycles, that kind of stuff. So I know there are exceptions to this, but in general, children's sleep-wake cycles are like much more in tune than adults are. They haven't done as many things to break that system as most adults have.
Yeah.
And so they do a really good job of like producing a sufficient amount of melatonin, responding to it while I'm falling asleep, like on a good schedule. And if you are somebody who is already on a pretty good schedule, you're going to probably be less impacted by the occasional exposure to blue light before bed as somebody who's just like chaotic all over the place with their melatonin production and sleep schedules. And then people who are older in general, like just like it's one of those things, we're less efficient at producing melatonin as we become older adults, especially if we're not working hard to maintain that system. So that is also like people who are going to be more sensitive to it. And then, and I know like Huberman has actually also talked about this, having other light exposure, like bright light first thing in the morning, and having your rhythms anchor to that makes you a little bit more resilient against exposure to brighter lights or blue lights later in the day.
Okay. Cool.
Yeah.
Awesome. Yeah. So if you can, real quick, because I know that you got to go, if you can touch on the recall or memory recall and like learning before bed. Do you have anything to say about that?
Yes. So your brain consolidates your learning while you're sleeping. And there have been some like really cool studies specifically around learning, physical learning, but also like mental, like learning words and like rote memorization, where if you learn, say, like a sequence of typing and you're making errors and then you go to sleep, your brain will actually error correct while you're sleeping. And then when you wake up in the morning, you will be better at typing that sequence than you were before you went to bed.
Oh, that's sweet.
Yeah. So like your brain actually not only consolidates the practice or the learning that you did, whether it's like, conceptual learning or physical learning, it will consolidate that, but it will also error correct. It does like revision. And especially if you have had cues around like what good looks like or what you're supposed to remember, your brain will actually go through this editing process of keeping the good and throwing out the bad. So not only do you learn, you actually enhance whatever you were learning while you're sleeping.
Wow, that's great. That's amazing. So the take home there, do Duolingo right before bed, because that's what I'm doing.
Totally. 100%. Duolingo before bed, or review your notes if you have an exam tomorrow, like whatever you need to remember. If you do it and then have some good sleep, you are better off than if you try to not do it, cram it in the morning, and then go write your test.
Sweet. Yeah, I'm trying to become fluent in Spanish again, so I've been cramming in the Duolingo right before bed, plus reading a book. So it looks like I'll be fluent in about a month.
Good for you.
Yeah. So anyways, thanks so much, Dr. Justine, for hopping on with me today. Hopefully we see you soon. Are you going to be at the CrossFit Games or anything?
Yeah, this was fun. I am not going to be at the CrossFit Games. I have a small infant, and we're spending more time closer to home and doing more baby things these days and less travel. But have a great time. We were at the CrossFit Games last year, and it was a blast. So
Yeah, heck
I'm
yeah.
sure you'll enjoy yourself.
Awesome. Well, thanks so much for hopping on here. I hope that people did find value in it. I'm sure that they will because I did. But I would like to get you on my other podcast if you're cool with it, so we can talk about building the brand and building the business around this. So if you'd be interested in that, I'd love to have you back. So anyway, you guys, thanks so much for watching. Like this video for Dr. Justine. I'm going to tell her that all of you guys liked it and subscribed and got more subscribers. And yeah, with that, Doctor, thanks so much for being here.
Thank you.
We'll talk to you later.
Bye.
See ya.